Well, I'd like to talk a minute about female wellness examinations. This is Dr. Clark Brittain of Vibrant Life, Bloomington, Indiana. You can visit us at www.drbrittain.com or view our Facebook page at Vibrant Life. So, what constitutes a wellness exam? When should it happen? How often should it happen? What are the particulars? So, the current recommendations are that women should begin getting what's called a pap smear about the age of 21. Now you can start getting examinations sooner than that for a lot of reasons. One of the reasons might be you're having a problem. Let's say you're worried about a bladder infection or a sexually transmitted infection. Those examinations can begin at any time, but a basic wellness examination, we start with pap smears about age 21. Well, what is a pap smear? A pap smear is a collection of some cells from the cervix to screen for precancerous and cancerous lesions of the cervix. In days gone by, cervix cancer was the leading cause of cancer death among women. With the advent of the pap smear in the 1930s, we started understanding a little bit more about the biology, if you will, of what happens with cervix cancer. And we understand now that almost all cervix cancer originates because of the virus HPV, which stands for human papillomavirus. So this virus can actually be detected both microscopically under the microscope from the cells that are removed from the cervix, and with a genetic test with DNA testing. So we employ the pap smear starting about the age of 21, and then there's several different ways to collect the pap smear and process it, but the current recommendations are that about every 3 years an actual pap smear should be performed. But that's not all that happens at a wellness examination. We want to know the height and the weight and the blood pressure. We want to know a little bit about family history, your own personal history. What are the medications are you taking? We want to know what kind of a social life you have. Do you smoke cigarettes? Are you drinking alcohol? Do you use drugs? Do you share needles with people? Do you have multiple sexual partners? Are there risks in your life that could be mitigated by informing you about what those risks might do to your life? So that should probably happen on an annual basis. In addition to getting that information, we want to know, what does your heart and lungs sound like? Do you have a normal breast examination? Do your is your skin intact? Are your organs paired up? We want to do an internal exam to check for the size and position of the uterus and ovaries, and check for pelvic floor support. Contraception is frequently an issue, and so women who are having intercourse with a male partner and don't want to get pregnant want to be on some kind of contraception. That can be natural family planning. It can be barrier methods like condoms. It can include oral contraceptives, IUDs, the implant, several different things that have been used in the past because they don't use any kind of devices, include early withdrawal, timing, and natural family planning have been shown to be less effective. So there's a little bit of controversy about some of these contraceptive methods, but in general, a contraceptive is a device or medication or a technique that keeps a woman from getting pregnant. Abortifacients interrupt an established pregnancy. Interception is a device or technique that's used to prevent a fertilized egg from getting implanted. So we want to know what the contraceptive needs are for women and what their sexual behaviors are and what their goals are for their wellness examination. So we do a pap smear, we do the examinations, and then we counsel them about these various things that we mentioned. This probably ought to get done on an annual basis, although a lot of women think that because they only need a pap smear every 3 years, then they only need to get an examination every 3 years. Well, as it turns out, our bodies change a lot on an annual basis. If you think about it, our skin changes all the time. Our red blood cells are replaced every 3 months, or about 4 months rather, and so our bodies are constantly evolving and changing. So you kind of want to be able to keep up on that. And sometimes these changes happen so gradually that we don't even notice it. But if a casual observer, like a physician or nurse practitioner, does these examinations once a year, they can discover the changes that happen and might be able to intervene to help prevent a bigger problem from happening. So these examinations are done. Your vitals are recorded. Your pap smear is recorded. And then we can compare results from one year to the next and see what kind of progress or changes are happening and help you with your overall health plan. I hope that helps explain the importance of and the technique of an annual examination. I'm Dr. Clark Brittain of Bloomington, Indiana, representing Vibrant Life. Visit us on the web at www.drbrittain.com or our Facebook page, Vibrant Life. Thank you very much.